Hi, good afternoon, good evening to all the participants, and I hope more will be joining. I am Dr. Nandini Gokulchandran, and hope you have all started your weekend in earnest. Weekends are important for rejuvenation and reviving ourselves. And in fact, today's talk about rejuvenation or repairing or reviving of the brain. What can we do to help individuals, children with neurological disorders such as autism, cerebral palsy, to improve in their quality of life, to improve in function, to improve in gaining their milestones. And what are the ways that brain can be helped to heal from inside? So today's topic is about holistic approach towards these conditions. So NeuroGen Brain and Spine Institute is an institute in Navi Mumbai, India, where we treat children with autism, cerebral palsy, and various disorders. And so, as the participants of this seminar, you, me, what are we here for? We are here to understand what can be done for our near and dear ones. If you are professionals, what can we do for our patients? If we are therapists, again, what can we do for our patients? So, if you have somebody in your family, what can you do for various children and individuals with neurological disorders? What is new and what is around the corner? Many of you might have attended some of these webinars before, but in life, whatever new that we do see, even if you see the same thing again and again, you do pick up new thoughts, new ideas, which might not have occurred to you earlier. So what is happening so far when we think about suppose say cerebral palsy or autism? What is happening? So as a parent or as a caretaker, you visit doctors, you go from doctors to therapists. You are told that okay, only rehabilitation and therapy is the only thing that you can do for your child, and which you do, and you do in your earnest. But at the same time, you are told there is no cure, there is no definitive treatment, and the only thing you can do is rehabilitation. However, this is no longer true. There are a lot of things that you can do for your child to be able, along with rehabilitation. So yes, rehabilitation is the pillar or the cornerstone of treatment for autism, cerebral palsy, and intellectual disability. However, there are newer things that's important to be informed to be able to make an informed decision. So what was the old thinking? The whole approach towards neurological disorder arises from the old dogma or thought that once brain is damaged or once the incapable of regenerating. But this is old thought. This is an old dogma. Almost 15 years back, this old thought process underwent a radical change. A new thinking based on scientific evidence came out that yes, regeneration is possible in the brain. For example, the evidence that we create new memories every day. Every experience that we have, every new phase that we see, we do remember. How do we do that? Because a part of our brain known as hippocampus is multiplying and it is reconnecting, it is networking every day. And that's why we store these new memories. So similarly, even if a part of the brain is damaged, it is possible to help repair, rejuvenate, regenerate through some help. And that help is repair and cellular replacement. So the old view was that for conditions such as autism, cerebral palsy, only rehabilitation is the only thing that is possible. However, the new view is that along with rehabilitation, we now have cellular therapy or stem cell therapy, and now more recent advances of integrative therapies, which comprise of oxygen therapy. So stem cell therapy and oxygen therapy, when you add on to the rehabilitation, you get a very good combination, a combination which together has a possibility to reverse autism and cerebral palsy. And that's what we are going to understand more about today. So I know I was talking about the brain, and suddenly you see this X-ray of a foot. How does this where is the head and where is the leg, right? But we are just using this as an example to put forth a point. So this is a fracture of the leg, and the fracture of the leg, what do we do? What is the standard treatment? Do we, see a fracture in the X-ray and say, okay, the bone will heal by itself, let me start walking, or let me start doing physiotherapy? No, yes, the bone will heal by itself, but we either put a cast so that it can repair, it can heal, or we do a surgery and repair it with plates and screws, right? And then once this repair has happened, then we start doing the exercise, physiotherapy, rehabilitation to be able to work better. Because if we do exercise on a fractured leg, we are bound to harm it more. Similarly for the brain, when we are pushing the brain, we are doing rehabilitation on a brain which is already damaged, we are likely to further harm it. So the focus or the principle is first repair the brain and then do the rehab. You will see better results. So this is a scan of the brain where you can see these blue areas are damaged or working less. With cellular therapy or with other modalities, we can improve the functioning of these areas. You can see the green means activated brain. And with this, as the brain starts repairing, then you do training, then you do rehabilitation, you will find better results. So the focus is on getting up and running. So children who are wheelchair bound, to help them get and start walking, those who are not able to go ahead in terms of academics, learning, socialization, communication, to help them get out into the world and be more constructive individuals and lead an independent life. So what are the three things that will help? So we know about rehab, stem cell, and integrative therapy. So let's start with stem cell therapy. So what is a stem cell? It's just like a stem of a tree, as you see. A stem of a tree, when given the water, gives rise to branches, and with time, leaves, flowers, and fruits. Similarly, there are cells in our body which multiply many, many times and are able to give rise to different tissues of our body, depending on where they are, what kind of signals or cues they are getting. So how do these cells work? They work by one cell multiplying into many cells. So one cell can make clones of itself, multiple thousands of cells similar to its own. And some of these cells would then differentiate and make cells. Like if I put them in the liver, they can become liver-like cells. If I put them in the heart, they can become heart-like cells. We are using them to improve the brain functioning. So we want them to reach near the brain, okay, as near the brain as possible, to be able to stimulate repair there. They release growth factors. So thousands of different types of growth factors which will stimulate, reduce the inflammation and stimulate neuronal repair and regeneration and improve the blood supply in the brain. So how do we improve the blood supply in the brain? By the process of neoangiogenesis, formation of new blood vessels, which are done by the hematopoietic stem cells in the stem cell component. So these are the different ways that stem cells act, and they help to repair, regenerate, and replace the damaged tissue. So this is a scan of the brain where you can see blue areas, the damaged areas. As the cells go to the brain, here the cells will go and improve the functioning, and you can see the dark blue has become less and the brain is improving in its function. There are two types of processes by which the transplantation can be done. So if I have a problem in my brain, I can take cells from my own body, that is known as autologous, take cells from my own body to replenish or to repair my brain. Or we can take cells from outside and put it in our body. So depending on the condition, depending on what we are planning to do, how are you going to, what is the route of administration, the type of transplantation would differ. What are the major types of stem cells that we know of, depending on the source of the cells? So source of the cells, so all of us at one point were cells, stem cells in our mother's womb. One cell would multiply into 2, into 4, into 8, into 16, 32, and a bunch of cells. And this bunch of cell would then give rise to stem cells, would give rise to, in fact, the whole child. When this embryo at 3 to 5 days of gestation is put in the on a culture dish and is allowed to multiply, it will form a full layer of embryonic stem cells. So these cells have the potential to form each and every tissue in our body. However, there are some ethical considerations and some medical considerations due to which they are not being used for treatment purposes. They are good research tools, however, treatment on ethical grounds that we are killing an embryo, because even though we are using those which are discarded embryos from in vitro fertilization clinics, still in certain religions, using these cells or using these embryo means we are killing a life. So ethical issues prevent these cells being used for treatment purposes, and there's a possibility of forming long-term bunches of cells known as teratomas, because that is their characteristic. So hence these are not recommended to be used for clinical treatment purposes. Then of course we have the cord blood. When we talk about stem cells, when I say, okay, I'm in the field of stem cell therapy, people ask me, oh, cord blood. So somehow that has become a stem cell is now correlated or directly, or people know it as cord blood cells. So yes, cord blood is one of the very important sources of stem cells. It is a very rich source of stem cells. And for the child whose stem cells it is, it can be life-saving in future life. As of now, indications for using cord blood is blood disorders like sickle cell anemia, thalassemia, and recently COVID. In COVID also, the cells from the cord have been tried. So blood disorders and lung disorders, yes, cord blood stem cells are a good source. For brain disorders, there are certain trials which are happening where cord blood of the child is being used or being infused intravenously to be able to help alleviate the symptoms of autism and cerebral palsy. So yes, that is a possibility. The third source that we have is the bone marrow, or from the adult stem cells, from the bone marrow, the fat of the patient's own. So here we don't need to rely on a donor. We can take from our own body, and these do not have any ethical issues because we are not killing an embryo. And unlike the cord blood, they do not need to be stored. They can be extracted and injected in the same setting. So that is the difference between a cord blood and an adult stem cell retrieval. In cord blood, because it is to be stored in minus 190 degrees centigrade, it requires a cryopreservant, and hence we have to be very careful while using it that that cryopreservant is completely it is washed off, otherwise it can be toxic to the brain. While in adult stem cells, though it is ours, and yes, the numbers may be theoretically less, however, absolutely safe because no chemical mixing and can be used fresh. Like, you go and buy fresh vegetables, so fresh without any preservation. So that again, because there are no ethical issues, no possibility of long-term tumorigenicity, adult stem cells now become a very feasible, potential, and encouraging source of stem cells without any side effects. So for clinical transplantation, adult stem cells, to some extent, cord blood stem cells. And we have a fourth category known as induced pluripotent stem cells. Induced pluripotent stem cells are something new, which new information keeps coming out every day. In 2012, Nobel Prize was awarded for the derivation for our understanding the concept of induced pluripotent stem cells, where we can convert an adult cell into an embryonic cell using various factors of stimulating. So my skin cells can be converted into an embryonic cell which resembles me, and that can again be converted into a blood cell in case I have a problem. So that lot of for retina problems, and now recently today's news is about for the cardiac issues, induced pluripotent stem cells have been studied. So again, so in clinical setting at NeuroGen, we choose to use adult stem cells from the bone marrow because they are safe, non-tumorogenic, no rejection issues, easily obtainable, and no ethical issue. We are not killing an embryo. So these cells can be injected in various ways. They can be injected into the brain directly if we consider it as a brain problem. Most efficient way would be to inject directly into the brain. However, it has its possible side effects, sometimes even death, because it's a morbid condition. If we are brain is a very delicate organ. We may be passing through normal brain tissue to reach to the damaged part. So that makes it a lot risky. Cells can be injected intranasally, as were being tried for COVID. It can be injected intramuscularly, directly in the heart or in the muscles, as for muscular dystrophy. It can be injected intravenously, possibly the easiest way of injecting. However, for heart and for systemic illnesses, intravenous is a good option because the cells will travel through various different organs. However, for brain, when we do intravenous, how much will reach the brain, we do not know. So that again is the efficiency goes down considerably, though it is least risky. So for purposes of brain, the current topic, because it focuses on that, we are now using something which is not very risky and has good efficiency. So we found a middle ground between going directly into the brain or going IV, and that is intrathecal, going into the spinal fluid. So this channel is connected directly to the brain. When we inject the cells into the spinal fluid, the cells reach the brain more directly than through the intravenous route. However, we are not going and injuring the brain, and hence very, very less risky. So minimally invasive, highly safe, and equally or as much effectiveness as intracerebral. So we have found the best of both the worlds. So what is the history of stem cells? Is this something which has come today, yesterday, day before? This is something which has been studied for years together. So if we see, the first ever Nobel Prize was awarded in 1990. So imagine at least 15, 20 years of work. So maybe 1970 it started, now almost 50 plus years of work on various types of stem cells. Started with the derivation of or understanding that bone marrow has stem cells. So we are working with the oldest, most understood source of stem cells, though for a different indication, that is the brain. So 1990, Dr. Thomas was awarded the Nobel Prize for demonstration of stem cells in 1990. Then 2007, the advent of the embryonic stem cell age, though again the work must have started in almost 1990. And recently in 2012, two professors, Professor Gurdon and Professor Shinya Yamanaka, were awarded the award for stem cell research on understanding the concept of induced pluripotent stem cells. At NeuroGen, what is the scientific basis? We believe in not only treating, but also researching. So we have almost 106, 107 publications on understanding the role of stem cells, especially the bone marrow derived stem cells, for a whole lot of varied neurological conditions, autism, cerebral palsy, intellectual disability, muscular dystrophy, spinal cord injury, brain stroke, amyotrophic lateral sclerosis, and other many different conditions like dementia and stroke and ataxia and Down syndrome. So we've looked at all the conditions that we treat and published papers, research, putting together our experience. So everything that we have done, the good as well as the possible side effects, everything is published and is out there in the public domain. We've also been invited to write books, book chapters for various books. This book on recent advances in autism has our book on stem cell therapy in autism. So we have put together what the world knows as well as what we know in this chapter, a chapter in the book known as Cerebral Palsy, Challenges for the Future, So what are the new things in cerebral palsy? All that is put together in this book. You can see there is a book on neuromuscular rehabilitation using newer techniques. There is a chapter on brain-computer interfaces for cerebral palsy, and there's a chapter on stem cell therapy for cerebral palsy written by us. A chapter on stem cell therapy in pediatric neurological disabilities in a book for physical disabilities and therapeutic implications. So newer therapies, what can help improve quality of life of a patient, so that again the burgeoning or the hot topic of stem cell is included in all the recent textbooks. So a lot of focus on the field of regenerative medicine and stem cells, muscular dystrophy. So this is our Prime Minister, who is very much supportive of stem cell and stem cell therapy. Professor Dr. Alok Sharma, presenting the book that we have written on stem cell therapy in neurological disorder to the Honorable Prime Minister, who has been supportive of stem cells even before he became a Prime Minister. When he became a Prime Minister, he went to meet Shanya Yamanaka in Japan, who was a Nobel laureate at the time, a recent Nobel laureate, to go and understand the use of iPSC cells for sickle cell anemia. He wrote a preface for the book that we have written on muscular dystrophy, a Gujarati translation. And he spoke in the parliament about his interest in stem cells for sickle cell anemia.
Nobel laureate scientist मैं इसलिए किया गया, उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी खोज हमारे काम आ सकती है। हम गए तो वहां गए, उनसे चर्चा की, और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So with all this background, how is the treatment done? Parents finally want to know. How is the treatment done? Is it simple? Is it going to cause my child any harm? Is it a surgery? Are we going to cut? Are we going to stitches? So it's a simple treatment. So just 2 needles, 1 needle in the hip bone, 1 needle in the back. So bone marrow is aspirated from the hip bone. This is the bone, and you can see this crest here. So if you touch your hip in the front, you can feel that bone, and that is the bone from where the bone marrow is going to be aspirated. So this is a thick part of the bone, and the needle is very, very thin. So nothing to be worried about. So the bone marrow is aspirated. It is like a thick blood, and it is centrifuged through a column. And you can see the red part is settling down, and the white part is what will be aspirated or purified and injected in the lower back here. So child is lying on the side, and the lower back is exposed and injected. So only using a thin needle. So this is so taking the bone marrow out, child is comfortable, sleeping in the centrifugation, separation, and then counting, and then injection. So this is as simple as it gets. No cut, no stitches. So let's look at what happens in autism. What can we expect? And we all know what autism is. It is a difficulty in social communication and interaction. There are some repetitive behaviors, and that's by limiting a child's response to everyday functioning. So it's not only about speech. It is a neurodevelopmental condition. It is the brain functioning, the brain circuit, the connections, the networking, the response of the brain to the external stimulus, which is affected. So we need to work holistically to help the child. Generally, parents think, oh, speech, will speech improve? Speech is one of the functions of the brain, but it is one of the most complex functions of the brain. We have to connect everything to be able to get a valid, a relevant speech output. So the neurodevelopmental disorder somehow occurring more in males than in females in terms of some hormonal influence possibly, and picked up as early as 1.5, 2 months. Parents start seeing a regression or a reversal. Now, why should we worry about it? Why should we look at, or even try find a cure or a definitive treatment for this condition? Because the prevalence is increasing. What was there in 2004? 1 in 166. In 2018, 1 in 59. in 2020, 1 in 40. So the numbers are alarming, they are increasing exponentially. Yes, we need to understand why it is increasing, but we also need to find a treatment which will help these individuals become productive members of the community. So we need to, of course, go back and understand the historical pathogenesis, but also go ahead and find a treatment. 70 million people in the world are on the spectrum, 1% of the world's population, which needs to be taken seriously. As I said, main problem, triad: poor social communication, poor social interaction, impaired communication, restricted repetitive behavior, so preventing us going ahead. But yes, this is a clinical symptom. What do we understand? I mean, we have better understanding of autism through imaging techniques now, and we have a possible definitive treatment for this, that is a stem cell therapy. So this is our original work. Many people say, okay, do we know what is happening? And, do we really need to do a scan? Does it tell us anything? Yes, it tells us a lot about the patient, a lot about the child, what is happening. So this is a PET scan. This is an advanced scan where you see the brain from the side view here. So the blue part here indicates low functioning brain. You can see the spectrum here. The blue indicates low functioning brain. Rest of the brain is functioning all right. So these are the areas which correlate with the symptoms of the child. So this is a area, the hippocampus or the medial temporal hippocampus and amygdala, which is important for comprehension, learning, understanding, memory, emotional expression, social interaction. Does it click some bells there? So here, cerebellum, fine motor activity, oromotor, functioning, articulation, balance, coordination. Basically, cerebellum is like the traffic police of the brain. I tell everybody, whatever the main brain needs to do, this will execute it. So if the traffic police is lethargic, if the traffic police is inactive, what is going to happen? There's a chaos on the roads. So that's what is happening here. There is input, but there is no processing and output. And that's why you do not get the relevant language. People say, oh, can you tell me if there's a problem in the speech area? The speech or the language area seems to be fine, but it's a comprehension and output which is the problem. Your child is capable of speaking, but he doesn't want to speak. He doesn't have motivation. He doesn't want to interact with people. So he's gone into a shell. Okay, he's gone into a cave. We need to pull the child out. So rehabilitation, training, socialization, all of that are one way. And giving the boost to the brain from inside is another way. So our understanding of what problem is in the brain was published in the World Journal of Nuclear Medicine. And what something very interesting that we see here is this graph represents that. You see the blue graph is a neurotypical brain of a neurotypical child. The orange is the brain of a child with autism. Many parents say, oh, my child was in fact better or faster than the others in the first 15 months of his life, 15 to 18 months. And that's what we see, the brain metabolism much higher in early infancy in a child with autism as compared to a neurotypical. However, in neurotypical first 10 years, the brain continues to improve and grow. Up to 15 years, first 10 years rapid, and the next 5 years does continue but slower. In case of a child with autism, the brain functioning or the brain metabolism seems to be going down. And that's why we feel that early intervention, if we start treatment early, catch hold of the child early, we can, this gap which keeps on increasing, we can try and reduce it and push the graph up. That's why early intervention, very important. Time is of essence. So in the last 10-15 years, the management of autism has evolved. So there was rehab, therapy, all of that. Plus now we have the concept of possibility of, toxic metals, circulation, aquatic therapy has been added on, art therapy has been added on, animal assisted therapy has been added on, physical therapy, a new concept for autism in a way, because generally autism is handled by occupational therapists, but we find that physical issues also prevent the child from sometimes developing. So adding that helps, different nutritional supplements, biomedical treatment. Now we're looking at stem cell therapy to improve the brain functioning and oxygen therapy to help these stem cells and the brain to regenerate or rejuvenate faster. So we heard about stem cell therapy. Now, of course, neurorehabilitation. Let us see how it adds on. Quickly, we'll just see applied behavioral analysis or cognitive rehabilitation or cognitive therapy or behavioral therapy. All of this to address the behavior of an individual. This works for any kind of behavioral issue in any individual, but has been applied in a very systematic manner for autism as well, to understand, okay, why is a child behaving in a particular way? Is there a trigger? Can we try and understand and then help change? I believe that behavior can be changed by improving comprehension. Because what do we do with the neurotypical child? This children also throw a tantrum, they roll on the floor and have long tantrums. But how do you resolve it? By once the tantrum ends, you make them sit and make them understand what is right, what is wrong, so that next time that tantrum is minimized or doesn't happen. Similarly, for children with autism, however, yes, the problem here is inability to receive what you are telling. Comprehension is sometimes limited. Academic comprehension may be great, but understanding of social concepts is the problem. That's why improving comprehension helps change the behavior. Motor impairments, physical therapist looks at this to help the child's tone of the body, improve coordination so that the child can concentrate better. So the physical therapist works on this. Occupational therapy, a very important part of autism rehabilitation, often ignored. Improvement in response to sensory stimulus is very helpful for the child to respond better to the external stimulus, because that's where is the problem. So it's a sensory processing issue as well. So also learning life skills, very important. What does the child need to learn? How to go to the bathroom, how to pee, how to brush his teeth. These simple things itself become challenging for a parent when a child doesn't respond appropriately. So occupational therapy helps in these as well. Very important milestones. If you want to send the child to school, the child should be at least toilet trained, isn't it? Sensory integration therapy. As I said, so sensory room, sometimes children overreact or underreact. That is a problem with autism. Very rarely appropriate response. So either they like a lot of pressure or they don't like to be touched. Or they like a lot of sound, or they just can't even bear normal conversation, they close their ears. Or, they love to chew random things, or they don't want you to put anything in their mouth. So these are, opposite reaction to the same sensory input. And that's where the sensory integration therapy helps by improving these response to various stimulation. Speech therapy. Speech therapy is not only about speech, it is about communication. So you have to train the child who is completely non-verbal to at least start, communicating via gestures or pictures, and then go on to the verbal communication. Once he starts being able to communicate, you can, teach him verbal as well. So communication is an important part. Start somewhere. Aquatic therapy, beautiful concept in water. Though I have water phobia, but most children love water and they love playing in water. So channelize this love in the right direction. Channelize this love of water to be able to improve physical endurance. Channelize this love of water to be able to focus and concentrate better. Channelize this love for water to improve coordination of hands and legs. And you will find output outside also better once the child, does all these activities in the pool. Art-based therapy. Use the child's love of art. Some children love painting and drawing. Use that so that they can use that in a way of expression, expressing their fears, expressing their wants, and feeling joy. And sometimes it can become a skill set for later life as well. Look at the child's potential. If he likes music, use that to get him out of his shell, to get him into the social spree. Now, heavy metals, parents worry about aluminium, parents worry about mercury, parents worry about lead and arsenic. A lot of toxic compounds in our environment may be one of the causes, yes, of the rising neurodevelopmental conditions. But generally, by and large, seen that these heavy metals affect the child's development when the child is in the mother's womb, when the brain is developing. Later on, it may have effect only if it's an extreme overdose. So yes, chelation is something which you can try. Yeah, but that is an individual choice. For stem cell therapy, at our center, not really required to do detox. Supplements, yes, B6, B12, vitamin C, omega-3, vitamin D, all these are supplements which are given as a part of biomedical treatment and can be taken, no problem. Diet and nutrition, yes, some diet is recommended, certain diets for children. General principle, avoid sugars, refined sugars, additives, pesticides, this and difficult to digest starch. And I think this is something which is for us also, right? As human beings, we are also eating a lot of toxic stuff and leading to increased amount of cancer of the gut because of what we are eating. So eat well, yes, and eat less of refined sugar, yes. Probiotics, more of probiotics, gluten-free, casein-free if possible. That helps to reduce your gas formation and thereby improving your concentration, improving your gut health, as well as improving absorption of nutrition. So what are the results? Overall, we have found about 90% success rate in the children that we have been treating over the years. It differs in different age groups, which I will be coming to. Generally, we find that better response in hyperactivity reduction, better concentration, eye contact is better, communication improves, comprehension, we can teach the child better. Therapists find it easier for the child to make the child sit and make him learn. That's what we find. This is the first ever proof of concept study on the use of stem cells in autism, which came from NeuroGen Brain and Spine Institute, first in the world in the year 2013. This is a PET scan of the brain where you can see before the treatment a lot of blue areas here, and after the treatment the blue has reduced. So the brain activity has improved from inside. You can see here the blue areas becoming lesser, so brain is healing. You can see here the blue becoming green. Similarly, over a period of a year and a half, you can see the blue reduce, the brain functioning improves. So the improvement continues, and we may need to, to boost the effect of the first treatment, give another treatment of between 6 months to a year. So there is progressive improvement. The second publication in 2020 from NeuroGen was published in the American Journal of Stem Cells, and we find sample size of 254. We analyzed 254 individuals between 2 years to 34 years range with a 7.5 months, half a year of follow-up with various outcomes. So generally, what did we find? We found social interaction improve in about 50% plus of patients, eye contact improve in maximum patients, sitting tolerance becoming better, command following becoming better, attention concentration becoming better. These are the major improvements. And then because of that, learning improves, and then communication and speech, hyperactivity and self-injurious behavior also reducing. On the various scales, we find ISA and CARS. These are the standard scales that we use we find them improved. That is from, for example, moderate to severe, get the child to moderate, and then slowly to mild to moderate. Based on severity, age, and gender, our understanding was that severity, both mild and moderate, improved. Success rate is 93%. In severe, there are only 2 patients in this category, so both of them improved. So that is not good enough numbers, but yes, mild and moderate improve equally. Those who are less than 5 years, this is a very important take-home message. Less than 5 years improve the maximum or possibility of improvement. This is showing possibility of improvement. So out of 100 patients who were treated less than 5 years, 97 to 98% showed improvement. Between 5 to 10 years, 94% showed improvement. And between 10 to 15 years, around 90%. So as the age increases, the possibility of success slightly reduces. But so earlier you treat, better the results. And because the brain is also, still evolving, bad habits have not been acquired, plus the child is amenable to be treated better. You are able to handle the child because he's younger, and parents are, much more open to really hard work and intervention. And at less than 5, as the child improves, even the parents are energized to do more and more. After a certain time, when the hormonal phase kicks in between 10 to 12, that's the most difficult time, and it becomes very difficult for parents to handle. They've been handling, treating or taking care of a child for so long. After some point, they also, their energy level goes down. Again, in terms of gender, both male and female improve equally well. Those who came to us early. So early means not only in age, but as soon as the diagnosis was made. If you come as soon as the diagnosis is made, almost 100% result. If you come between 1 to 5 years, about 95% result. And if you come after 5 years of diagnosis, then 90 to 92% result. So there's a whole lot of evidence. People say, oh, still experimental, no evidence, but look at the evidence, 9 publications. First coming from India, second from China, third from Italy, 4th from US, 5th from US, 6th again from India, from NeuroGen, 7th Vietnam, 8th Iraq, and 9th US. So that is enough publication work, both about safety and efficacy, which you must go through. All the publications from NeuroGen on autism. Let's see a few examples. I think these are examples you see every day. And you have to see them to believe. Yes, because I've seen these children myself, the way they have evolved, it's beautiful. This is a child from the US who we're very proud of.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that.
I'm sorry.
18 months to the age of 2 years, he just slid backwards.
He would flap like that. He would walk on his tiptoes, look at the wall, and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about neurology. But the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
Started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood is so much calmer now. He's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level.
Isn't that fantastic? So his comprehension improved, his reading improved, his understanding, his learning language improved. He became better in school. His sensory issues reduced. His interaction with his brothers and peers became better. So this child, even though he was treated at the age of 10 by us, before that he was getting all rehab in the US, has improved drastically. It also depends on how you approach the condition, the problem. It's an ongoing work. Of course, every child parenting is an ongoing thing. It's not easy at any point of time for anybody, especially in autism. Let's look at the triplets, story of the triplets.
Doctors, we went to different hospitals, and when I brought something, one like, oh no, don't worry, because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye. My child is crying. No child is really back by, and by then for sure I knew that they should be doing that. Children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to solve this? I went to see the neurologist, and in 5 minutes, he said, children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autism is.
So I decided to really get to read about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. It's of apprehension. Anxiety, of course, as a mother, but I knew they would.
We put a needle in this pelvic bone, and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The transplants are reduced. Sleeping used to be a problem before, but at the moment, it's taken to his bed, it takes a few minutes, and he's asleep.
You see my son's side now. You try to make them understand what it is to help and important. But after stem cell, when we arrived in Kenya, the following day, we went out, and these guys would cycle.
I'm just going to go ahead because this is definitely, you can see it online, but to give you an update about these children, they are now 10 years old. The first triplet, Rick, is now learning keyboard. They are here in India, and they are going out, socializing. Rick has learned how to play Janagana Mana. He played this on the Autism Day function that we had here. Eric and Lenny are also improving beautifully. One of them is a wizard in swimming and can hold his breath below water, and we're looking at him becoming like maybe an Olympic swimmer. So, so these talents of these children are coming out. Yes, not all of them speak perfectly. Rick is very good in conversation. Eric is getting there, and Lenny is still using different methods of communication. However, in terms of their growth and ability to respond and interact with people, that there's been a huge shift. So this is an ongoing process, and we are always there to help guide and help the children reach their best potential ever. I tell parents, let's help your child become the best that he or she can at any point of time. So this is story of Victor. Victor is from Kenya. He was at home for 13 years, no schooling, nothing. He was extremely hyperactive, running out, removing clothes, and eating like a half a kilo of salt. He had no understanding about what's going on. After stem cell therapy and with like really patient handling, he has come to a level where his parents are able to take care of him. He is improving in his understanding of his surrounding, able to swim now, is doing cycling, goes to a school, does fine motor activity, uses a mobile, and started also vocalizing. So it is, again, everything is a process, and the earlier you start, better the results. One more example, this is Zach. When he came to us 4 years, you can see very, very initially totally unresponsive, couldn't even hold the pen. You can see how he was. After 6 months, after a year, he came back. He was much better. Still, he was non-verbal earlier, maybe like 1 or 2 words. You can see he was very, very typically autistic. Just look at this is what at 4 years, 1 year after he came, 5 years, responding much better, can focus. Focus had started initially, was able to hold the pen, complete his tasks. Parents are still, focusing and trying, and we will see how he is now. Okay, so just make a note of how he was before, and where is Zach now? Let us see, where is Zach now? Okay, come on, I'm sorry. Okay, this is Zach now.
Once upon a time, Peter Pan was walking down the street and said, "Love is white shoes so much." Then the song. I love my white shoes. I love my white shoes. I love.
Point to be noted, this is not taught. This is something he is spontaneously developed this story, and he loves recording himself, maybe to the point of obsession. So this is how Zachary has come 3 years down the line. We saw him first at 4 years, 5 years, and now this was November 2020 when mother sent me this video. So this is how far he has come in 3 years. So I believe that we lay a good foundation when we start with stem cell therapy early on. You may not see the magic then, but it keeps on happening over time. So that is about autism. Now let's look at how we can help cerebral palsy children. Cerebral palsy is basically oxygen deprivation or any event that occurs before, during, or after birth, leading to brain functioning getting affected, leading to physical issues as well, apart from cognitive functioning. So this can be because of problem during pregnancy, during labor, or shortly after birth. Different parts of the brain get affected. You can see here the left part of the brain, just a part of it. So the right side of the body is not functioning properly. When both sides of the brain, then the whole body is affected. When a whole lot, then again you can see even trunk is affected. When inner part of the brain, that is the basal ganglia, then we see athertoid. And when the cerebellum is affected, ataxic. So depending on which part of the brain is damaged, you can see the damage here. Much different from autism, right? So the black area is completely scarred. It is gliosis. So there is no tissue there, and stem cell is not magical enough to get this scar back. No, the scar will remain. But this light blue area around it is what we are going to improve. The light blue areas is what is going to get activated to be able to take over the function of the completely damaged part. Medical management for cerebral palsy includes medications to control spasticity, convulsions, Botox to reduce the overactive muscles. Basically, it is injected directly into the muscle to reduce the spasticity. If spasticity or tightness is too much, a neurological procedure known as dorsal rhizotomy can be done. That is, the nerve bundles around the spine can be cut, or there can be a tendon lengthening at the ankle if it is too much deformed. Stem cell again looks at addressing the brain functioning, and when we improve the brain from inside, we get about 90% of the children to improve in their overall functioning. Let us see what functions can improve. We generally find central part of the body improving. So, understanding comprehension improves, then eye function, the focus improves, oromotor improves, neck holding, sitting balance, and then standing and walking. Then comes the tone of the body and the tone of the hand muscles. If there is too much movement, then the movement becomes much more coordinated. This is the brain when you see before the treatment, a lot of damage, the black area and the blue area. As I said, the black area is not going to really improve, but the blue areas will get activated. So we can rescue the low functioning areas. And as the brain improves, you can see here, the blue areas here becoming more active. This is more evident. You can see the frontoparietal, the blue area damage. It is improving in function. You can see that the brain is much more active. The blue becoming green. This is one of our clinical studies where we showed the improvements or the progress in children with autism. These are our published data. Let us see a few examples. This is a child with severe brain damage. You can see first time treated in 2016. You can see only this part of the brain is there, nothing here. Okay, with time, the brain function. See now, in 2019, this versus this. You can see activity, whether there was hardly any activity, it is improved. So we had fantastic improvement, but it took time. So earlier he was completely bedridden, completely, nothing, no understanding, no awareness, physically completely. Then with time, he improved, his awareness became better, neck holding improved, hardly had any neck holding, trunk control improved. You can see trunk control is better, or we are not at all. Slowly he became more aware, then sit to stand improved, legs were completely reformed, slowly standing improved. Then his ability, you can see he is trying to get up on his own here, hardly anything. Then, with some support, starting to walk. So this is come a long way from not being able to even hold his neck to be, so constant training, and you can see the brain also developing. So it is a loop, brain is stimulated, you're doing therapy, it activates each other. And that's why continuous process of rehabilitation is a must. People feel, oh, if I'm doing stem cell, why should I do therapy? No, you have to do therapy. We never say you have to, be, miserly on therapy. No, you have to be rich in therapy. You can see this child who was bare, not even standing, is now walking without support. So this is possible. This is possible if you persevere. This is possible if you continue. You can give your child a better quality life if you start early. Very important to start early. This is Alex from Kenya. Came to us when he was 14 years old, 8th standard. He was on the wheelchair when he came to us. He was not even able to stand, but with stem cell, he was and good rehabilitation. In a month, we were able to get him to stand, wear his own clothes, use his phone, pack his own bag, use a mobile, connect the mobile, go to the fridge, take out a bottle of water, open it and drink. For us, it may seem a big deal. For that child, it was about becoming more and more independent. And you can see now walking independently. Amazing. Even at 14 years, it is possible, right? This is another child who came to us with barely just about neck holding. Even sitting was affected, ataxic cerebral palsy, no speech, some amount of cognition was there. Progressively improving to such extent now that now he's going to school and he talks so much that now parents want him to stop talking. So he's improved in all areas, ability to go to school, cognitive development, speech, walk, understand, rationalize. So at least his foundation has really helped him. We're hoping that one day he becomes an engineer and doctor. So why not? He started really early. That's what I keep telling parents. Keep working. It is possible to get your child to lead an independent life. So I can go on and on with examples. Let's move to the next one, that is intellectual disability. Again, the principle is the same here, the intellectual disability. There is a deficiency in cognitive abilities. And again, the PET scan, you can see the blue areas functioning less. Improvement in 84 to 85% of individuals with intellectual disability, improvement in cognition, memory, problem solving, understanding of relations, social inhibitions, and toiletry. Improvement in brain functioning before and after. And again, the first ever publication on intellectual disability, nobody really focuses. These conditions have now been labeled into disability, and not even in health. They are just shifted to disability. So we have to get these individuals into mainstream, let people know that we have to do something for them. So this is the first ever publication which shows that it is possible to repair a brain even in a child, an individual with intellectual disability. You can see the brain. You can see a whole lot of blue areas. That means the brain tissue is there, but functioning is so low. So this is before the treatment, and you can see here, it's all green after the treatment. 6 months, beautiful improvement in metabolism in all the areas. Again here. Publications on intellectual disability from NeuroGen. Well, this is one of my favorite patients. She loves me, I love her. So her name is Pratibha. She came to us when she was 26 years old, and I never tire of telling her story. It is such a beautiful story. She came to her at 26. Parents had been working with her since she was 2 or 3 years old. When at that point she was diagnosed with autism, maybe with time she lost her autistic symptoms. When she came to us, she was intellectual. A child with intellectual functioning performing sitar. Isn't that amazing?
Very nice. Smells good, looks good.
And Sanjeev Kapoor, one of our celebrity chefs, appreciating her during one of the competitions. So Pratibha has come a long way, not only in cognition, independence, ability to take care of herself, maturity, social maturity, conversation, and amazing. So if we can start earlier, isn't it always better? Though at 26 we found improvement. This is another oldish intellectual disability, the child individual who was not even able to focus. You can see that he didn't focus when therapist is telling you before, but later with after stem cell, when you did the same therapy, he is able to improve in speech, identifying objects, better compliance, frustration tolerance is better, is able to focus better. So even in older individuals, we are able to get improvements. Of course, as compared to a younger child, the improvements will be qualitatively less. Down syndrome, again, though it is a chromosomal disorder, many people tell me, oh, if there is a genetic problem, what do we do? This Down syndrome is a chromosomal condition when there are 321s here, there's extra pair of extra chromosome of 21, trisomy 21, where there is, of course, a whole lot of other problems. Features are different, the ear is different, eyes are different, the facial features, but cardiac issues may be there, thyroid issues may be there, the neck may be shorter, there could be hernia. So all of these are medical surgical issues which need to be treated separately. But then we have a cognitive issue component also. The brain development is slower, and it appears that these individuals, children, age faster. It looks like they might have Alzheimer's at an earlier age. So that's where the stem cell is looking at helping. We can help improve the IQ so that possibly later we should be able to prevent or delay the Alzheimer's also. So again, our focus is on looking at brain functioning. We do PET scan and we can see that the blue areas of the brain improve. I hope you are able to see improves. So the brain functioning improves. This is a child who came to us at the age of 12 years. She's 15 now. After she was going to her school, she was doing all rehab. Parents very, very motivated, very positive. With stem cell, they found beautiful result. I could see that improving maturity, speech clarity, understanding, learning, physical tone of the body. A child was not able to climb the ladder, is now able to dance, and they keep sending me dance videos of this child. So, and speech clarity, I'm able to understand what she says on the phone as well. So overall holistic improvement in all areas of this child. So even Down syndrome, if so our muscular dystrophy is another condition where the muscles keep deteriorating. Though we do not have it's a genetic condition, though stem cell is not a definitive cure, it is an interim solution where we can keep muscles from deteriorating and help the individual stay stable for a longer time. So young children who lose their life by the age of 2022, we are able to keep them walking longer to prevent complications. So that is one condition that we can help to at least improve quality of life so that, they are not on a death sentence. So this is our aim in muscular dystrophy, to keep individuals. So this is a child who came to us when he was 9 years old. He's now 14. He's here in India right now. He's still walking, though with difficulty, but he's still walking. So we've been able to keep this child and this teenager, his aspirations of becoming an adult individual. We have been able to keep it alive. So spinal cord injury, when there is a damage to the spine, neck down paralyzed or face down paralyzed, patients can also be helped. These are our publications. And this is an individual who came from Nigeria, spinal cord injury, cervical neck down paralyzed, and road traffic accident, young boy whose dreams stopped suddenly. Now we are able to at least get him to be able to stand and walk, though with support. So with stem cell and good rehabilitation, he's recovering his function, and he has a hope of getting back to life. He's going to study geology and become a professional soon. So this is possible. This is a slow and steady, lot of hard work. Nothing comes without hard work. So spinal cord injury, brain stroke, one of the most common neurological conditions with, again, no definitive treatment. If caught early, yes, there is intervention which can help prevent the neurodeficit. But once neurodeficit occurs, really not much apart from rehab that you can do, and that's where stem cell therapy helps. Again, you can see the PET scan before the treatment, the dark blue areas improving in functioning. So we can salvage some of the part and help recover in function. These are the publications and improvement videos. Stroke ataxia is again a genetic condition where the problem starts sometimes very early, sometimes in young age, and it's progressive. People stop ambulation. The cerebellum, small brain, is shrinking physically. So we are helping with stem cell to prevent the shrinking and help return of function. Head injury, patients can also be helped with stem cell. We have about a 90% success rate here with improvement in brain functioning. Our publications. Motor neuron disease, a chronic condition, progressive degenerative neuromuscular condition, focuses on to give stability. This is a condition with which Stephen Hawking, despite which he survived and got a Nobel Prize. So are there any complications to this procedure? No major adverse events, no irreversible neurological deterioration. But yes, there is a possibility of epilepsy or seizures in 3% of patients who already have a history of seizure ever in their life, or if EEG is abnormal. So that is a possibility. We can be prevented and reduced by giving proper anti-epileptic cover. A possibility of spinal headache in 10% of patients, along with nausea and vomiting. It is transient and gets all right in about 3 to 4 days after the procedure. Integrative therapy is something new and addition that we see is helping as a complementary process along with stem cell and rehabilitation. So hyperbaric therapy and ozone primarily. So this is hyperbaric therapy. The principle is that when we breathe oxygen, we are breathing, when we breathe air, we are breathing about 20% oxygen at normal atmospheric pressure. So the oxygen goes into our bloodstream, only into the red blood cells. In this chamber, 100% oxygen is infused and slowly the pressure is increased. So this is a child along with the parent. Of course, child will not go in alone, and there is a television here. So child can see whatever he likes to see, and you can see this is what happens is the red blood cells is oxygen here inside. So this is at normal pressure and 20% oxygen. Here at 100% oxygen and increased pressure, you can see the oxygen goes into the plasma here also. So not only in the red blood cell, but plasma. So more oxygen diffuses throughout the body from head to toe. Benefits here we can see increased immunity, stimulates oxygenation, improves metabolism, increases energy level, reduces fatigue, improves overall functioning, and it helps, we have seen it helps engraftment of the cells, stimulates stem cells as well. Ozone therapy, ozone is 2 oxygen, oxygen is 2 atoms of O, and then ozone it is 3. So, but you can see this bond is a bit weak. So it is an unstable but an extremely active oxygen. And when it goes into our body, it divides and gives out oxygen with an oxygen atom, which is extremely strong. It kills the viruses, bacteria. It's a germicidal. It reduces inflammation and swelling. It reduces the blood clots. It's an antioxidant. It is a 100%, so we convert 100% medical grade oxygen through an ozonator into ozone. Acts as an antioxidant, anticoagulant, thins out the blood. So we've used it in COVID as well. So there are different ways of giving the ozone. We generally, for children, give it through rectal route and through ear. It has a potent anticoagulant effect. It improves the gut health. Gut is one of the issues in many children. Improves oxygenation. So benefits are kills bacteria, viruses, detoxifies your body, reduces inflammation, anti-aging, increases energy, increases oxygen, strengthens your immune system. Gut cleansing, this process is more for adults. In children, it is done through enema, and ozone. In adults, it is done through a process known as hydrocolon therapy. This hydrocolon therapy applicable for adults. And again, we have deep tissue mobilization or acupressure. By applying pressure at different points, we can help relax the body, improve oxygenation, and again stimulate your immune system. Vitamins, if vitamins are low, then vitamin supplementation is also done. So this is NeuroGen Brain and Spine Institute, where all of you are welcome. We've treated over 11,500 patients from 75 different countries. This is our core team, which still is there and is walking and rocking. We have an all-in-one facility where all therapies and procedures can be done at one place, very near a beautiful lake in Navi Mumbai, with an in-house operation theater and a state-of-art laboratory setup. Good living, comfortable living facilities, comprehensive rehab under one roof with all professionals, including clinical as well as paraclinical, all together working in sync. All therapists. How does so therapies help in stimulating the neuroplasticity? Stem cell helps to stimulate the neuroplasticity. Together, they work as a team. Physiotherapy department, these are all a therapy. Physiotherapy, occupational therapy. Autism Child Development Center. Spinal cord injury walking track. Sensory integration therapy. Special education, art therapy. These are all our books which are available online. Accreditation, our awards. These are our contact. How do you reach us? This is our website, www.neurogenbsi.com. Contact at neurogenbsi.com. You can call us and we can set up a Skype interview or a consultation. Each one of the people who reach us is allotted a coordinator. That coordinator becomes your one point of contact for help, who helps you entire process. We have two types of programs, as a 1 week program and a 2 week In 1 week, you arrive Sunday, Monday, we undergo all test evaluation and scans. Tuesday is the stem cell procedure, Wednesday to Saturday rehabilitation, discharge on a Saturday. 2 weeks, similar to start with Sunday, Monday is all evaluation. Tuesday is the stem cell therapy. Wednesday to next Saturday is the rehabilitation and integrative therapies. So hyperbaric oxygen therapy, ozone therapy, and deep tissue mobilization. How are we different from other centers? There are so many centers, and we know that. So we have the largest number of scientific publications. We assess, analyze, and study all that we do. We have written book chapters in international books. We have been invited to write them. That shows our credibility, that we are experts in the field. We are the only center which treats or focuses on only neurological conditions in stem cell therapy and holistic therapies. We use safe autologous stem cells, and which are injected intrathecally so that it reaches directly to the brain. We combine stem cell with comprehensive rehabilitation and integrative therapy, and we have been there for the last 14 years, having treated 11,500 patients. We have senior experienced professionals monitoring all the work that is being done and part of the treatment and research process, constantly researching, evolving, finding new treatment solutions. And our work is approved by institutional ethics committee, which is registered at the government level. So in conclusion, adult stem cells are safe and effective, and they can be used for autism, cerebral palsy, and other neurological conditions. So we are where there is no hope. This combination is a ray of hope, combination where you will get a path ahead for life.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers. Seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So this is to give you a glimpse about what had happened in 2001, because there was a ban on federal funding for embryonic stem cell research, which was there since 2001 under the George Bush regime. In 2008, President Obama reversed that ban. So since then, things have moved ahead in the US, but even before that, a lot of work happened in the rest of the world. So that's why the East is ahead of the West. So anyway, thank you for patient hearing, and you can reach us. These are our contacts, and I would be happy to take questions. Please do put your question in this question answer section. So I have a question here from Martin. He says, is mild autism completely curable through stem cell therapy? Yes, it is completely reversible. We have treated children with mild autism who are now absolutely better in many areas, better than their peers, and doing excellent. So yes, it is possible to get. So cure, very rarely do I use this word in connection with autism because it is not a disease, but yes, autism is completely reversible, and we can get an individual child to lead a completely independent life and excel in his field of choice. So yes, it is possible. What if there is no low functioning part in the brain? Would you still go ahead with stem cell therapy to treat autism? So by another experience is that there is some problem in the brain, definitely, but it may be mild, it may be a lot. If there is no part of the brain which is hyperfunctioning, then only training and rehabilitation should be enough. But our experience so far has shown that there is there is always, the degree varies, but there is always some lacunae. Yes. What about cerebral ataxia in adult? Oh, I'm sorry, I didn't realize that there was an audience who wanted to know about cerebral ataxia, but yes, in adults, cerebral ataxia is generally due to oxygen deprivation or sometimes blood supply to the brain is affected. And yes, it can be treated. Again, the focus in ataxia, because it is a degenerative condition, it progresses, is to stabilize the condition. So combination of stem cell with integrative and rehabilitation is working quite well for these adults. Any other question? If there any other question, please do reach out to us and we will be happy to answer them. And we will reach out to you also, and we can have a one-on-one consultation with our team of doctors. If there are no more questions, I would bid you a happy weekend. I think there's one more question. Okay. I have sleep. I'm sorry, I didn't get your name because your name says Galaxy J7 Pro, but we will reach out to you, understand more about your condition. Are you saying sleep disorder which causes ataxia? So let us evaluate your condition better, what exactly is the problem, and we should be able to give you an answer how we can help you. Thank you, Mr. Pandey, for attending, and thank you all the participants. Sleep apnea. Okay, yeah. Yes, sleep apnea. So you need to treat the sleep apnea first, and once the sleep apnea is treated, then we can help the ataxia. So yes, it is possible to help improve. The sleep apnea basically causes oxygen deprivation to the brain, and that in turn may lead the brain to shrink. So that's what is happening. So first address the cause, and the effect, which is ataxia, can be reversed. So thank you for patient sharing. Have a great weekend and do reach us.